share a little bit about yourself?
I'm sorry, just that last part again.
Can I have you before we begin, can you introduce yourself and share a bit about your background?
Yes, happy to do that. My name is Kathryn Clores. I work in mental health care as a director of a recreational creative arts therapy department in inpatient psychiatric care. I am a music therapist, board certified. I also have a degree in classical music performance. So I have those two perspectives when it comes to music and music therapy. And I also very recently completed coursework for a Master of Social Work with a focus on mental health and trauma. So, as you can see from my background, my primary focus is mental health. I have also worked with children with varying special needs as well as older adults in memory care. So I'm happy to talk with you today. I'm really glad to be able to share some information about music therapy, how it can help in many facets of healthcare, and really glad to hear that you're interested in learning more about it.
That's great. And that's amazing. Like you have like a lot of like background information and like different types of music, not just classical. So before we do like start everything, I want you, because as like a music therapist, I want you to like kind of like explain what music therapy is and how it differs from just like listening to music for like enjoyment.
Yeah, so happy to do that. And I think that's probably the most important thing when anyone's talking about music therapy is to first talk about what it actually is. So, the way I would define music therapy, and there are varying definitions from different clinicians, but utilizing music in different forms as a tool to reach a clinical goal. So, really, we're talking about musical experiences. So, where this differs from music performance or let's say music education is that the goal in music therapy is not to be a refined or even competent musician. You're not being assessed on your musical skill when you are engaging in music therapy as a client. And that's the same for music education. While there is psychoeducation involved in music therapy, when we're educating clients on the benefits of music, we aren't necessarily teaching anyone how to be a musician.
Mm-hmm.
But in the same light, I think it's important to stress the idea that everyone has a different connection to music. Some of those connections are based on their experiences from, let's say, adolescence or other parts of their life. There are also many cultural dynamics to music. So, the most important thing to know about music therapy is you need a music therapist who has completed an academic program, who is a certified music therapist, to be able to assess all of those dynamics to best serve the client's needs.
That makes so much more sense now because I think like a lot of people like assume that music is like just to be enjoyable and that like any use of music is therapy. But from what you're saying, like there's more of like a structured approach behind it, more than just like putting on a playlist and listening to it at school.
Yeah, and I think it's important to stress, it's like a really good point you make about like just putting on a playlist. Music is therapeutic to many people in many different ways, but it doesn't make it music therapy. And something that I think is really important to understand is that depending on the type of potentially crisis that an individual might be experiencing, I work in crisis, so that's kind of where my mind goes. Let's just say, for an example, if someone is in an inpatient psychiatric facility, the music that they may ordinarily go to when they're feeling stressed to kind of regulate their emotions, to kind of reduce anxiety symptoms, that music is going to sound very different to them when they're in an inpatient psych facility. And in that moment, it may not be healthy for that individual to hear certain music. When you hear certain music and it takes you right back, like,
Yeah.
and like everyone knows that, like everyone can identify with that. Um, Depending on where you are in your life, you may or may not be feeling that,
Mm,
depending on what your needs are at the time.
yeah. I like that a lot because that's like a really different way to like interpret music because it's not just like something that brings back good memories for other people. It's something that can harbor like bad memories, like bad trauma.
Yeah, definitely. And from a trauma perspective, if we're talking about music being triggering, you're not going to know when that hits you. You could be in a moment where you're not expecting and you could be triggered by music. And because music is so ingrained in our society's culture, we just think about music as accessible at all different times in our life, but you have to be careful with music. And for the same reason that people put on headphones and walk through the city or wherever they're going on the train, and that musical experience for them is isolating and helps them decompress and perhaps even regulate their emotions. That same reason is why we want to make sure if someone is experiencing either a crisis or challenges in their life, that musical experience is sort of overseen, so to speak, by a professional who understands the impact that music can have on people when they're not feeling quite themselves.
Like that. So if there were a situation where like music is bringing up like distressing emotions for a patient, how would you like navigate that situation?
So I think it varies depending on the situation. Firstly, I would just sort of evaluate how well I know that person.
Mm,
So if this is somebody I've met with before in maybe a few sessions, or if this is someone I'm just meeting for the first time, I may have to adjust the way I respond. But first and
mhm,
foremost, I would check in with them. What's coming up for you? And I would assess that in the moment. And if I felt as though the person were not safe in that moment, I would redirect that interaction and then learn more. Sometimes moments that a clinician might perceive as someone being not okay isn't necessarily the case. So that's why
mhm,
we kind of do a check in and then gather more information. And then from there, we could maybe resume or steer it in a different direction,
mhm.
but mostly using clinical judgment to let the client take that lead while also assessing the situation.
Yeah. And you just kind of brought up something like starting into a different direction, but I was gonna ask, like, do you like find that like gradually introducing like just like a different type of like or certain types of music helps? Or is there more about like finding like a certain like musical alternative that feels like safer or like better to the individual as well?
So I'd say the answer is yes, but it would be based on that individual. So a couple of examples might be someone is feeling dysregulated or particularly overwhelmed in a certain moment, and that could be emotionally, like mentally, they're overwhelmed. It could also be overstimulation, which happens a lot with kids or adults with developmental challenges. So if we're talking about someone not having an opportunity to regulate and they have an uncomfortable response to certain music, again, it goes back to that initial assessment. What do I know about this person in terms of their history, in terms of what they're experiencing right now? What are the symptoms that have brought them to this particular treatment? And also, what is their psychosocial dynamic? What is their cultural dynamic? Because music that I might say is soothing or comforting,
Yeah.
that isn't necessarily what it means for everyone else. And most certainly, most of the time, it is not, because we all have different experiences.
Mhm. So like have you seen cases where like well like this is kind of like shifting just like a little bit, but like have you seen cases where like music like kind of like I'm trying to figure out how to word it, but like not so much on like distress like bringing distressing emotion, but also but actually like promotes like emotional like regulation and enhances. cognitive or but also enhances cognitive functions like memory or focus.
You're saying that music that I've experienced does that for someone and they don't have
Yeah,
the same response, or they are having a positive experience from it?
yeah, when they're having a positive experience from it.
Yeah, so what comes to mind, I worked in trauma in childhood, most of them. Primarily, they were in the working with the Agency for Substance Use Recovery and also
Mm-hmm.
mental health treatment. Some of these clients had been incarcerated, some of them had family situations that were not safe for them. And they had all different backgrounds in the sense that some kids grew up with one parent or two parents, or grandmother raised them, or they grew up in foster care. So, in that kind of a setting where kids have so many different experiences, you have to really determine, especially in groups, it's a challenge to determine what everybody might need because everybody's experiences are different. However, a common thread that I observed when working with these kids was their parents' music. You know what I mean by that when I say
Yeah,
someone's music? Okay.
yeah,
So, like your music primarily, or anyone's music they might identify with, often occurs during adolescence at a coming of age, a certain period of development where we started deciding for ourselves what kind of music we like. But it's important to stress our parents' music, whatever that music is, impacts us as well. So, something that I was able to kind of connect with all these kids was they all responded to their parents' music. Now, because their parents are different ages, come from different backgrounds, perhaps were born in different countries, they're not all going to be the same. So that's important. Any clinician, of course, would have to assess that. But them sharing in a setting like that about their parents' music was not only bringing up positive response for them emotionally, but opportunity to socially connect with their peers that is not connected to them. Because there's a lot of like, especially in adolescence, like, oh, that song is corny and who's like judging whose
yeah,
music. There's none of that when it's like, oh, my pops love this song, or my grandma raised me and would play this music in the house and things like that. So that's something that I would say I had a lot of success with in reaching those kids because I think of all of those factors that we talked about.
and I like that approach because that's like for the music engagement program that we're trying to like kind of like create.
Mhm.
That's like something that we stumble upon like individuals with like different like various backgrounds and like catering to like each and every individuals. So like as a music therapist, how do you like approach like incorporating music in ways that kind of like respects the cultural differences or background differences while still using it as like a therapeutic tool?
Well, I would say the first step is going into any session, whether it be a group or an individual, and really taking into account there should be no perceived notions of anything. You are just, as a clinician, taking that information from the client. So while I might look at a history, a treatment history, a family history, engage in an assessment, I just take that opportunity to gather as much information as possible and not presume anything about anyone that I meet with. And it's something that is an ongoing practice for any clinician. You're meeting with people whose history and journey is so complicated. All of our histories are complicated. There isn't one person who matches somebody else. And some folks who have a background that is particularly focused on a culture, and music is so cultural, right?
Yeah.
So there's so many cultures that really utilize music as a way to gather, as a way for prayer, for meditation, for community, camaraderie, right? Um, and different stages of life as well, ritualistic stages, utilizing music in that way. It's important for us to be able to determine that we as the clinician, we don't understand all of that. We can't possibly if we haven't been in that situation, but we can learn, right? So if, let's say I'm in a group and I've got a couple folks in the group who I know don't speak English as a first language,
Mhm.
I'm going to find a way to incorporate music that they can connect to. And that means that everyone's going to have to adjust one way or another,
Yeah.
just like that individual had to incorporate whatever they're going through into the English lyrics. So sometimes that means not utilizing lyrics.
Yeah.
Sometimes it means messing with different rhythms that are assigned essentially to different cultures that are derived from different cultures. So it's tricky, but I would say like to do it in a way that lets that client lead is you just have to take that information and really learn from them.
That's really like insightful because that means that like even when you're already like a board certified music therapist, you're always like constantly learning and like adapting to like each person's background.
Mhm.
And that it must make it like challenging, but it's also probably like rewarding when you see like the way that people like react or like feel after listening to music. So like have you ever like when you have worked with someone who has a different like cultural background, like what was the like outcome? Like how did they like respond?
Well, what I would say firstly is this is so important in healthcare.
Mm.
It is so important to not make assumptions about anyone's experiences and to not presume that we know everything about all music, even those of us who have a lot of experience with music. So, this is a phrase I'm sure you've heard many times. When people ask somebody, oh, what kind of music do you like? Or what kind of music do you listen to? And there's a common response that I hear, I listen to everything. And it's interesting to me when people say that. Everything is that person's perspective of what music is. Because I could almost guarantee they don't listen to everything that has ever existed. Kind of like food, right? Oh, I eat everything. I don't know. Could you possibly eat everything? Could you possibly eat all food from across the entire world, all types of food? Maybe. Maybe like real foodie type of people have experienced all types of food, all types of music. But the way I look at that is that's that person's perspective of what music is. It is so much more complicated than that. There's so much music that it's just impossible for all of us, any of us, to listen to all of it and make an assessment of what we like and what we don't like. So when it comes to working with individuals who identify comfort in music that others in the room do not identify with, or perhaps music that I don't know, I have to do my research. It means having some tools in front of me, right? I need to have the internet. I need to have access to iTunes, which has a lot of music on it, more than some other platforms, which is why I like it because there's like more broad range of music. But being able to adjust very quickly in the moment to reach that person. And what I have found is that very often the individual who is seeking comfort from music that others in the group may not identify with, they're appreciative that anyone is even trying to
Yeah,
identify and share. And I think that's just so cool. Like, I think it's just so great in that moment
yeah,
for that person to be part of the group. They are in the group, so as clinicians, like you mentioned, like learning, and we have to keep learning. We have to do that. That's a commitment we have to our clients. And knowing that no matter how educated we become, we can't possibly know everything
Yeah.
about everyone's culture. It's just not possible. So we have to commit to learning every day.
I like how you answer because with the way like the tone you speak in, it's kind of like the music therapy isn't only like benefiting the people like the clients you're working with, but you yourself like you enjoy what you do. So I wanted to like kind of shift gears and ask like how does it impact not just the clients but also the staff who like work in these
Yeah.
environments?
Well, I'll preface that statement by saying that I have a special relationship with music,
Mm.
not unlike my colleagues in music therapy and not unlike people who grew up playing music. Um, I had a interesting transition because I came from a very competitive classical focused career in music for many years before I transitioned into music therapy work and went back to school to study that. And for me, what was really cool was the relief that came from not having that pressure. There's a lot of, while I love classical music and that always is going to be a part of me, there is that perfectionist dynamic
Yeah.
that is very, very stressful. And to transition to become a music therapist, while it's hard work in a different way because you're playing many more instruments, you're in the moment having to adjust, you're learning all of, your healthcare um academic courses you're taking, you're learning about multiple diagnoses, you're learning about multiple populations. That is a challenge. However, for me, it's a relief to not have to be perfect. And I think in that moment with clients, we're just into it with the music.
Mhm.
It's the best thing ever. When you have a group or even a session and someone is really responding to
Mhm.
what you're working on with them, you feel like you're getting somewhere with them and you feel like the music did that for them.
Mhm.
And from some of my past experiences, while I would never trade it, and I'm glad I've had the trajectory I've had, you don't always get that. You don't
Mhm.
get that gratification because you're always striving to be better. And music therapy just takes that edge off. It's just like,
Yeah.
this is what it is. Like, this is the real thing.
Do you ever find yourself like incorporating some of the classical music elements in like music therapy?
Yeah, definitely. I mean, particularly if I've worked with musicians in a music
Mhm.
therapy setting, and a lot of stuff that might come up from childhood or things like that sometimes stems around that. Additionally, if you're working with a musician, you can go a little bit deeper into
Yeah.
the musical experiences. They don't have to be formed in a way that any person with, regardless of their musical experience, could be able to do. You could actually play classical pieces on the piano, or there are so many things that you could do. But when it comes to utilizing classical music, the fundamentals of why music is so great for young developing minds, that continues on with adults and also in music therapy. So I think it's important to mention that, and you might know this from your research, that
Mhm.
music is actually stimulating both hemispheres of the brain at the same time. So that's a
Yeah.
big part of why it works with so
Yeah.
many populations. So if you're talking about your left side, right, we're talking about motor skills and we're talking about language. And then the right side, we're talking more about those emotions.
Mhm.
So that's happening for, like, let's say kids taking piano lessons, guitar
Mhm.
lessons, all that. That's happening for them. And that's very often why you tend to get kids who are very intellectual or
Yeah.
very focused on academics or probably many things in their life, right? Because they have that kind of mind where
Yeah.
they focus on that. It doesn't mean that others whose minds work differently can't benefit from music lessons. But what's happening in music therapy is you're still, again, it just comes down to the music. You've
Mm-hmm.
got rhythm, which is helping to reduce anxiety symptoms. You've got serotonin levels that are being impacted by being
Mm-hmm.
exposed to music, just being around music, hearing it, and then engaging in music in a group is enhancing your social skills, which is
Mm-hmm.
awesome for every population. So I think when it comes to classical music, that the fundamentals, at least from a Western perspective, really come down to like what is all of the stuff put together that helps people cognitively, social, in terms of social connection and overall mood stability. All of that is connected.
I think I want to ask, do you work with like certain age groups, like elderly or youth? Because it was kind of like it sounded like you work with like elderly, like older, not elder, like older people. And I wanted to ask, like, if you do work with like younger people, do you see like a difference in the effect? Because you were talking about like kids and like piano lessons and stuff like that.
So in the past, I've worked with much older adults.
Hmm.
Primarily now, I'm working with middle-aged to younger adults and adolescents. I do some private practice music therapy work outside of my full-time job. In my
Hmm.
full-time job, where I'm more of an administrative role there, that age group really is a wide span. So we could have as young as 5 years old admitted, and as old as into their 70s, and all with varying needs and functioning levels. But when it comes to working with older adults versus working with adolescents or children, interestingly, I have found that when we're talking about what a person's needs are, that's how we're creating those goals, right? So if an older adult is not remembering their family, is having trouble remembering day to day functioning, is not getting the most out of their experiences because of those deficits, music is great for that. I have seen older adults who do not know their kids' names, they don't remember, dementia patients, right? And they can sing word for word a song from their youth with a music therapist. It's unbelievable. That is the stuff that stays with you. So, very often, that stimulation can assist with some of those other deficits. And the same goes for kids, but a different focus. So now when we're focused on a lot of developmental delays with kids, anxiety, a lot of stress, emotional dysregulation, what we're looking for is stability, comfort, and something that a kid can kind of grasp as their own experience, and focusing on self-esteem. That's what I tend to focus on when I work,
Hmm.
especially in psych, is self-esteem. And also, how are you utilizing the music to improve your outlook for the future? So the response that I'll see with kids, while it's a different response because we're focusing maybe on different needs, it's very similar in the sense that we want to feel connected to something. So that older adult who's hearing a song that they haven't heard in 30 or 40 years and they know every single word to it, versus the kid who's engaged in a drum circle with peers, they're feeling connected to something. It's bringing memories, it's maybe making them smile, right? And
Hmm.
those are experiences that we're looking for with both of those populations.
Hmm. So like from that question, I want to like kind of like address like a bigger thing of like how like this like how like music therapy has like such a powerful impact on individuals, especially when it comes to like memory and emotional regulation. But like despite its effectiveness, like there's still a stigma surrounding it,
Mhm.
especially when it comes to like youth and even elders. So what do you think like kind of like contributes to that stigma? And how do you think we can kind of like work to destigmatize it and shift
Yeah.
the perspective.
So when it comes to music therapy, I think a lot of people don't know what it is.
Mm,
And I think people have this image in their head of like, I don't know, like someone like gallivanting in a forest with a guitar or something. And maybe it is that, maybe there is a need for that. Um, but the idea of folks understanding that this is a healthcare profession and the idea that some therapists are utilizing talk to reach a goal, so talk therapy. Some therapists are utilizing physical movement to reach a goal, physical therapists, right? Some therapists are using pharmacotherapy to reach a goal, like psychiatrists. So to understand that this has a place in healthcare, it is a challenge to advocate for your field. I think this is something that probably all music therapists go through. I think this is
mhm,
probably something a lot of either recreational therapists, creative arts therapists, art therapists, um, they're all going through this because there's a lot of education involved. And
mhm,
the individual knows what is involved because they did it. They went through it. They went through the training. They did all the things that you do. But I think it's really hard and also sometimes exhausting to
mhm,
advocate for something that you know is so valuable. So, what I would say is one way to kind of address that is more people talking about the benefits of music therapy. So, I'll share just an example unrelated to music therapy, but a similar idea. I've had hand troubles most of my adult life. Um, Tried a lot of different treatments. One of the few things that worked for me was acupuncture. So when I talk to other people who have hand troubles and I say acupuncture, oh, I never thought of that. Oh, does that really work? Well, sure, I'm telling you, it worked for me. I tell people a lot about acupuncture because I think it's something that I want people to know about because
mhm,
maybe some people, other things didn't work or they don't want to try other things. I haven't gone all the way to have a surgery. I don't want to do that. I'm a musician. I'm afraid to do that, for carpal tunnel surgeries, things like that. I know some people think it's simple, but for me, it doesn't work. So for me to educate people on something that worked for me, allows that person to say, oh, why don't I try that? This person told me it worked for them. It's the same thing with music therapy and so many other disciplines that maybe people don't know a lot about. Think about folks who still are apprehensive about talk therapy, the idea of
mhm,
seeing the therapist when we know all of the benefits. So, more folks talking about it, people becoming educated, and also clinicians in healthcare becoming educated.
mhm, mhm.
That's really
Yeah.
important because if you're working for an agency that doesn't even know what music therapy is, that's not really going to help your cause. So, and there's a part of that too. People just don't know what they don't know. You can't hold everybody responsible for knowing everything about everything, but
Mhm.
to educate your peers, your colleagues, so that they have a better understanding and ultimately will help enhance their programming. It's what it comes down to.
Well, I wanted to thank you so much for answering all my questions, even though some of them were quite a lot. But all your responses were like really good. Like they really like I learned something today. So I really appreciate all your insights and all you shared about music therapy. And it's really clear like how impactful it is like for mental health and cognitive health.
Mhm.
And I'm excited to take everything I've learned and share it with others. So thanks again for your time and for all the work you do to like impact the lives of others and even yourself.
Well, Conchilo, I really appreciate you. Just being asked to talk about music therapy is a pleasure for me. And I think you're doing great things. And I look forward to seeing the growth of your agency and more that you can do to help music therapy and reach people who need it.
Thank you. Thank you so much.
It's my
Have a good
pleasure.
night.
Good night.